Peroxide-based mouth rinses by Amber, Alena, Kaylee, and Sydney. A peroxide-based mouth rinse is a rinse that contains peroxide as its active ingredient. The two most common peroxide used in dentistry are hydrogen peroxide and carbamide peroxide. The most common uses for peroxide-based mouth rinses are oral debriding agent and teeth whitening. The three common brands of peroxide-based mouth rinses are Peroxil, Clausis, and diluted hydrogen peroxide. The active ingredients for each are as follows. Peroxil has 1.5% of hydrogen peroxide. Clausis has chlorine dioxide and chlorite, and hydrogen peroxide, which is over the counter, has 3% hydrogen peroxide. Peroxil by Colgate. Product characteristics. Oxygenating action removes oral debris. 1.5% hydrogen peroxide. Great tasting flavors available. Alcohol-free formula with mild mint flavor. Product benefits. Facilitates healing, relieves discomfort, and provides a whole mouth clean. Helps reduce bacteria in minor oral wounds to help prevent infection. Patient compliance. Ideal for patients with sensitive mouths. Product characteristics for Clausis. It's ideal for sensitive patients. It also kills 99.9% of harmful bacteria in 10 seconds. No alcohol to burn your mouth. It is CPC-free and gluten-free. Product benefits is that it's naturally activated and pH balanced for sensitive and dry mouths. It also soothes mouth sores. It reduces plaque with brushing. Great for gum health. Kills germs for a noticeably cleaner and fresher mouth. Clausis is the first mouth rinse awarded by the ADA seal for eliminating bad breath.
Do you suffer with sensitive teeth, gums, or even mouth sores? Many of my patients do. That's why I recommend Clausis mouthwash. It's like first aid for your mouth. Clausis is specially formulated for people with sensitive mouths, with a gentle mouthwash for every person in the family. There's Clausis mouthwash in sensitive and ultra-sensitive that's pH balanced to be as gentle as water. The patented formula effectively kills harmful bacteria while leaving the good bacteria you need for exceptional oral health. For my patients 55 and older, I recommend Clausis Silver Mouthwash. The non-irritating rinse has all the same benefits, and it's also designed to strengthen enamel that weakens as you age. And for even better results, use the soothing, sulfate-free Clausis toothpaste. You can have a healthy mouth and fresh breath without painful burn and irritation. Soothe your sensitive mouth with the gentlest oral care ever.
Get Clausis now at Target, CVS, Walgreens, and Walmart.
Hydrogen peroxide. Product characteristics. Hydrogen peroxide contains hydrogen and oxygen molecules. There are different strengths available, and the most common strength is 3%. Hydrogen peroxide is a bleaching agent. It must be diluted 1 part hydrogen peroxide to 2 parts of water. Product benefits. Because of its antibacterial properties, hydrogen peroxide may help treat gum disease. Gargling with hydrogen peroxide may help treat minor mouth irritations such as cuts and canker sores. Hydrogen peroxide reduces the level of bacteria in the mouth and throat and can help ease a sore throat. The cost for the Peroxil and the Clausis mouth rinses are higher than your typical antiseptic mouthwash such as Listerine or Apt. The 16.9 fluid ounce Peroxil mouth rinse cost $8.99 at Target and $13.49 at CVS. The 32-ounce closest mouth rinse cost $11.48 at Walmart and $13.49 at Target. A bottle of hydrogen peroxide is very inexpensive and can be found at almost any store. A 32 fluid ounce bottle of 3% hydrogen peroxide cost $1 at Rite Aid and 95 cents at Target. Peroxide indications. Peroxide is for temporary use to cleanse canker sores in minor wounds or minor gum inflammation resulting from minor dental procedures, dentures, orthodontic appliances, accidental injury, or other irritations of the mouth and gums such as mouth burns, cheek bites, and toothbrush abrasions. Contraindications include healthy gingiva and allergies to the ingredients. Indications for closis are canker sores, chemotherapy sores, sensitive and dry mouths, and bad breath. Contraindications include allergies to the ingredients, healthy gingiva, and sensitivity to non-steroidal anti-inflammatory drugs. Indications for hydrogen peroxide are minor mouth irritations such as cuts, canker sores, and gum inflammation. Contraindications include allergies to the ingredients and hypersensitivity. It is important to note that these products may be dangerous if swallowed. If an overdose is suspected, call the Poison Control Center or get medical care right away. Patient instructions for Peroxide. Adults and children 2 years of age and older. Rinse half a capful around in the mouth over the affected area for at least 1 minute, then spit out. Use up to 4 times daily after meals and at bedtime or as directed by a dentist or physician. Instructions for closis. Closis mouth rinse works best when used immediately after brushing with closis toothpaste, as they combine to help the active ingredient, chlorostan, clean, freshen, and balance the mouth pH. Pour a ½ ounce and swish for 30 seconds to 1 minute, then spit out. Instructions for hydrogen peroxide. Use a 3% concentration of hydrogen peroxide. Mix 2 parts water with 1 part hydrogen peroxide. Gargle, swishing the solution all around the mouth for up to 1 minute, and then spit the solution out. All of these product reviews were found on Amazon. The Peroxide review says, the best canker sore relief I've found so far. It says, I have braces and get canker sores constantly. I tried this and they cleared up within 5 or so days. That's incredible. And while using it, it stops the pain for a few hours. Just remember to reuse approximately 3 or 4 times a day. I did it after every meal. The pain relief doesn't last very long, and only using this once a day might not yield the same results. The review for closis says, I have been using this mouthwash and the toothpaste for 3 months. I've ordered it twice as the system lasted about a month and a half. I have periodontal disease and pockets as deep as 4, 5, and 6 in some teeth. Today I went for my 3-month perio cleaning and exam, and my periodontist was extremely pleased. My pockets have reduced to mostly 3s and 2s in most places. No more bleeding gums or cavities. She said, whatever you're doing or using, keep doing it. I brush and rinse 2 times a day, morning and night, and I also use a water pick 1 time a day before bed. I am a lifelong customer now, as I am now a witness to how great this product is. No bad taste and well worth the money. My mouth feels so clean. Buy this. The review for hydrogen peroxide is for teeth whitening. It says, outside of disinfecting cuts and abrasions, I use this product for teeth whitening. Gargle 3 to 4 times per week with a small amount mixed in water. I see a huge difference in the whiteness of my teeth just after 1 week of use. Review question for the class. Peroxide-based mouth rinses are best for treating A. Canker sores, B. Minor gum inflammation, C. Mouth burns, D. Bad breath, or E. All of the above. The answer is E. All of the above. Peroxide-based mouth rinses have many different uses, which is why they are a good choice for people who experience mouth irritations often. Other considerations. All three of these products have also been known to dissolve tonsil stones. Tonsil stones occur when different types of debris such as dead cells, mucus, saliva, and food get trapped in the tonsil pockets and build up. Bacteria and fungi feed on this buildup and cause a distinct odor. Over time, the debris hardens into a tonsil stone. Regular use of mouthwashes containing oxidizing agents, such as hydrogen peroxide, can cause black hairy tongue. Though unattractive, black hairy tongue is usually a temporary, harmless condition. Black hairy tongue usually resolves by eliminating possible causes or contributing factors and practicing good oral hygiene. COVID-19. The risk to dentists, dental staff, and patients of infectious diseases through aerosols has especially been recognized during the COVID-19 pandemic. Hydrogen peroxide-based rinses are currently being used in many dental offices as pre-procedural mouth rinses to reduce the level of oral microorganisms and splatter and aerosols generated during dental procedures. Research article. The article, an in vitro comparative study determining bactericidal activity of stabilized chlorine dioxide and other oral rinses, by David Drake, MS, PhD, Alyssa L. Vilhauer, BS, compares Colossus and other oral rinses currently available on the market. This in-lab study showed the effect different mouth rinses have on different bacteria. Around 11 oral bacteria associated with oral disease were evaluated in this study. Each bacterium was added to test tubes and incubated, followed by numerous tests, and culture purity was confirmed. Following these tests, each oral rinse was added to the bacteria and was tested after 1 minute and 5 minutes. The samples were added to agar plates and were incubated for 24 to 96 hours. In conclusion, the bactericidal data show that Colossus oral rinse exhibits strong bactericidal activity against a spectrum of oral bacteria and other opportunistic pathogens. Colossus completely eliminated most bacteria within 1 minute. It completely killed Actinomyces viscus within 5 minutes and reduced other bacteria within 5 minutes. Colossus and chlorhexidine samples exhibited identical 100% killing of the test suspensions.
Hey guys, it's Sydney and Kaylee here. We just wanted to do a quick demo on how to use a peroxide-based mouth rinse. This one right here is Peroxo, as you can see. And what we're going to do is we're going to swish with it for around 30 seconds to a minute. And once we're done, we will go ahead and spit all of it out. You just want to make sure that when you're done, you don't rinse after and you don't eat or drink afterwards. So this solution is just baking soda and vinegar, but it's going to represent the peroxide mouth rinse. And in the next clip, it'll show what happens inside the mouth. So what's happening is the peroxide is oxygenating, and those bubbles help heal oral sores, irritations, and mouth burns, and it also is killing bacteria.